Bismillahirrahmanirrahim. I'm Dr. Abdul Rahman and we are learning ECG. In this video, I will focus on to the normal anatomy of heart, and when I say normal anatomy, I will just discuss normal coronary blood supply and how coronary circulation works and which wall of the heart is supplied by which vessel, because it will eventually help us in diagnosing different conditions on ECG. I will just restrict myself to that portion of heart anatomy which is related to findings in the ECG. Okay, so let me take you to the whiteboard which I have over here. I will draw coronary circulation, and we know that coronary circulation starts from the aorta. This is the aorta which is originating from left ventricle. Just at the origin of aorta, we have two main branches of the aorta. One on the right side is the right coronary artery, on the left side is the left coronary artery. Okay, and left coronary artery is also known as left main coronary artery. We call it left main coronary artery because just after the origin and even in the proximal portion of the left coronary artery, it gives off two very important and big branches. One comes anteriorly, this one. The one coming anteriorly is called left anterior descending artery, and the one which goes to the lateral side of the heart, it is called left circumflex artery. Because this one LAD, left anterior descending artery, comes anteriorly, so it will supply to the anterior wall, and it will travel anteriorly. It will go at the base of the heart, and sometime in some cases it will go around on the base of the heart. We will discuss later on. On the other hand, left circumflex artery, it will go to the left side. Left side means it will go to the lateral side and splice to the lateral wall of the heart. And lateral wall is made up of, we know that, left atrium and left ventricle. So it will supply left atrium and left ventricle, and then it will travel at the back of the heart and continues and sometimes contributes to the posterior circulation as well, or posterior descending artery. We will discuss later on. So first of all, I will take right coronary artery to explain. So we have aorta which gives us two branches: right coronary artery, left coronary artery, or left main coronary artery. Left coronary artery gives us two branches: left anterior descending and left circumflex artery. And if you come back to the right coronary artery, there is right coronary artery doesn't give any main branch in its proximal portion, so it will continue as right coronary artery and supply to the right side of the heart, which will be including right atrium, right ventricle, and structure in the right atrium and ventricle. There will be SA node, and there will be AV node. Okay, and later we will see. So this is right coronary artery. It follows downwards, supplying to the right side, right atrium and right ventricle. Then it goes down and continues as the marginal artery, and this marginal artery supplies to the inferior border of the heart. So there is another blood supply supplies to the inferior wall. Okay, and then it will continue on the posterior side and give off 90% of the cases, if give off a branch at the posterior side, and this branch is called posterior descending artery. Just like anterior descending artery, there is a posterior descending artery, and posterior descending artery supplies to the posterior wall. Okay, so then sixth structure which is supplied by right coronary artery will be posterior wall. You get my point? So these are the six structures at least which are supplied by right coronary artery. And there is one more thing, because right coronary artery supplies to the posterior circulation, so it also gives blood supply to the posterior portion of the septum. interventricular septum. And the seventh structure which is supplied by the right coronary artery is the posterior septum. Okay, and anterior portion of the septum will be supplied by the left anterior descending artery, LAD. Okay, so just to remind you again, we have aorta, gives of two branches, right coronary artery, left coronary artery. Left coronary artery gives two branches, left anterior descending, left circumflex artery. Coming to the right side, right coronary artery supplies to the right atrium, right ventricle, SA node in the atrium, AV node in the atrium, and then it continues as marginal artery which supplies the inferior border of the heart. Then it continues as a posterior descending artery which supplies to the posterior wall of the heart, and along with that, because it goes posteriorly, it will give off posterior branches, posterior septal branches which will supply the posterior part of the septum. Okay, and now let's go. This was all about right coronary artery. So let's take left anterior descending artery. This was the right, and this was left main, and as I told you, it has two arteries. So left anterior descending I will discuss now. So left anterior descending, it continues in the interventricular area. So on this side there will be right ventricle, on this side there will be left ventricle, and this will be the area of septum, and it will continue along that. And because it is lying anteriorly, so it will supply to the anterior portion of the septum, right? Anterior septum, anterior 2/3 of the septum is supplied by left anterior descending. Second, it will supply to the anterior wall because it is lying anteriorly. That's simple. Okay, and as I told you, sometime what does it do? It will continue sometime, not always, only 10% of the cases it will continue along the inferior border of the heart, just like right coronary artery continues on the inferior border. Just like the right coronary artery, left anterior descending can also continue and wrap around the inferior border and supplies to the inferior wall of the heart, and this type of branch of left coronary artery is called wrap around branch. So wrap around branch can also be there. So in case of wrap around branch, it supplies to the inferior wall or inferior border of the heart. Okay, so what are the structures supplied by left anterior descending artery? Basically anterior wall, anterior portion of the septum, and sometime inferior wall and border. Okay, and there are some branches which originate from left anterior descending. So when it comes down, there are some branches here that are called septal branches which supply to the septum, and there are some diagonal branches which supplies to the anterior wall of the heart. So this is all about left anterior descending. So whenever there is problem in the anterior wall, we will think about left anterior descending. And now let's discuss about the last artery, that is the left circumflex artery. Okay, this was LAD, and now I will talk about left circumflex artery, because left circumflex artery is going to the left side and it will supply to the lateral border, and lateral border will be including left atrium, it will be including left ventricle, or we can say that lateral wall. Okay, and then it continues posteriorly, and in 10% of cases it will make, only in 10% of cases it will make posterior descending artery. I told you that posterior descending artery is mainly made by going up right coronary artery. So posterior descending artery is the branch of right coronary artery 90% of the cases, but in 10% of the cases posterior descending artery can be from the left circumflex artery as well. Okay, and moreover, regarding AV node, AV node is located over here, SA node is located over here. So SA node is almost always supplied by right coronary artery, but AV node, again, it is mostly about 90% of time it is supplied by right coronary artery, but in 10% of cases it can be supplied by left circumflex artery. So we can say that 10% of cases it can supply AV node. But the most important I have mentioned over here, that is the lateral wall. Okay, so in a nutshell, here I will summarize: right coronary artery, right atrium, right ventricle, AV node, SA node, inferior wall, and posterior wall. That's finished. Left anterior descending, anterior wall, anterior septum. This is the most important. Finish. Left circumflex artery is supplied to the lateral wall, which include left atrium and left ventricle. That's finish. Okay, so if we talk about the septum, so septum anterior portion is supplied by LAD and posterior portion is supplied by the RCA, right coronary artery. So this is the whole, this is all of the blood supply of the heart. I will explain it with the help of one image as well. So let's take this image. I will show you. Sorry, it's here. So this is the a relatively better diagram as compared to what I have drawn. So let's have a look. So this is aorta, this is right coronary artery, as I explained. This is left main coronary artery because it gives two blood supply, one is the circumflex artery and other one is anterior descending. This anterior descending descends between right ventricle and left ventricle. Okay, and one thing I forgot, left anterior descending also supplies to the apex of the heart as well. So it goes all around to the apex, and these are the branches which I told you, septal branches, and on the left side these are diagonal branches. So aorta, RCA, left main coronary artery, circumflex artery, anterior descending supply to the anterior wall, RCA supply to the inferior and posterior wall, and circumflex artery supplies to the lateral wall of the heart. Okay, that's it. So this was all about the circulation. In next video I will tell you the coronary circulation but in a different plane. This was it for this video.